I've known that I wanted to be a dental hygienist since I went to my dental office back in eighth grade. It was a really informative day, and I knew that this career was going to be for me. So, this was me on my last day of high school, which is also my last day of dental assisting school with my instructor. During my junior year, I started my prerequisites and a dental assisting program through concurrent enrollment. And this was a really pivotal time and confirmed that I wanted to pursue this career in dental hygiene after I finished high school. So here I am at one of the offices I worked at as a dental assistant. The day I got my acceptance letter was a moment I'll never forget. I had to read the email a few times to really confirm that it said I was accepted. I was anticipating that I wouldn't get in and I'd have to prepare to reapply in the fall. But to my luck and surprise, I got in and started that June. So Competency 1 states that CCD dental hygiene graduates will demonstrate ethical and professional behavior in all aspects of the profession. For 1.1 and 1.2, I used the example of the case studies that we did in our Ethics and Practice Management course. We got into groups and applied the ethical principles to specific case studies. For 1.4 and 1.7, 1.8, and 1.9, I used a patient case. Through the patient confidential paperwork that we give to all the patients, I attained informed consent before I proceeded with their appointment. This patient had not had dental care in about 7 years, so it was important to not judge or discriminate against them. This patient also preferred communication through electronic mediums and this was provided through the Google Voice number. This is the patient's medical history, treatment plan, and then this is the consent form that we obtained before we did the cleaning. We have hard charting, perio charting, FMX, and then this is just the example of the communication that I had with him through the Google Voice number. For 1.5, this was demonstrated through a patient's chart notes and the importance of having noted and detailed notes for the patient's medical history. This is just demonstrated by describing all the yes questions they had, like seeing a physician for regular care, having a cold reaction to penicillin. This just helps the legal aspects of dental hygiene, and if they were to ever sue, then you could come back and have this as an example of how thorough you were. And then for 1.3 and 1.6, this was demonstrated through the mandatory reporter training that we did in clinical theory, which was very important because hygienists are responsible and accountable for reporting abuse that they see in their chair. Competency 2 states CCD dental hygiene graduates will employ the dental hygiene process of care, principles of dental hygiene diagnosis, and treatment planning to meet the needs of a diverse patient population. For 2.1 and 2.3, I used a patient example. This patient had a high plaque index and a really high bleeding on probing. So I made the diagnostic statement of gingivitis and heavy calculus load due to more than 30% BOP and 82% plaque in 53 sites of subgingival calculus. And this was noted both in their chart and treatment plan. This is the patient's medical history, PRA, which was high, treatment plan, and then in the treatment plan, that statement is just noted here under the periodontal diagnosis. Same thing here in the chart notes. Here's the calculus index, FMX, hard charting, and perio chart. 2.2 and 2.4 were demonstrated through the oral hygiene instruction competency that we had in pre-clinic. This utilized our interviewing skills and our ability to think on your feet and make changes for how the patient is currently doing their OHI and how they could improve. For 2.5, this was demonstrated through the tooth drawings that we did in dental anatomy, where we learned the normal appearance of the maxillary first molar and central incisor. So this has helped us out in the clinical field of having a baseline knowledge of any anomalies or what's normal. So here is the molar and the incisor. 2.6 was demonstrated through the super heavy patient that I saw in the fall and then saw back in the spring of second year. And there were some changes to their perio charting, some reduction in pocket depths that helped evaluate and modify their treatment going forward. Competency 3 states that CCD dental hygiene graduates will promote the oral and general health of the patient through the competent provision of dental hygiene knowledge and skills. 3.2 and 3.3 were demonstrated through the sugar tracking activity we did in nutrition. This helped us understand reasons why patients might be having a high caries risk or are at higher risk of diabetes, which affects the oral cavity. 3.4 and 3.8 were demonstrated through this FMX that I took on a patient to assess their current restorations and the need for future restorations following ADA guidelines. And this patient had complex dental needs due to the extent of restorations they've had. 3.1, 3.5, 3.6 were demonstrated through a patient case. I originally saw them in the summer, and the patient did indicate on their health history here that they do use smokeless tobacco. So we had that discussion back in the summer. And then when we did the smoking cessation project, I followed up with them again, and we completed another smoking cessation. As seen here in the treatment plan, the short-term goal was to quit nicotine. The Pano, FMX, perio chart, and hard charting. And then here's that specific smoking cessation assignment completed in the second semester of second year. And then for 3.7 and 3.8, we completed a disability modification project in Clinical Theory 2. We chose fiber syndrome and created an aid here to help people with limited mobility in their elbow joints, make brushing a little bit easier. Competency 4 states CCD dental hygiene graduates will initiate, assume responsibility for, and deliver health promotion and disease prevention activities to culturally and socioeconomically diverse population in a variety of settings. 4.1 and 4.2 were demonstrated through my volunteer experience with the Special Olympics Special Smiles, where we created mouth guards. This really opened my eyes to the importance of treating everybody with kindness and the importance of helping others. 4.3 was demonstrated through our Community Dental Health 2 class, where we created a project and website for children ages 3 to 6. We focused on parafunctional habits, teaching children to independently brush, and the benefits and uses of oral appliances. 4.4, we participated in external clinical rotations where we visited an assisted living community and provided oral care pertinent to their age. 4.5 was demonstrated through our special needs competency. My individual had autism spectrum disorder and obsessive compulsive disorder, which made him an ADL/IEDL1. And it was really important to look at to communicate thoroughly and answer any questions that the patient had during their appointment. Competency 5 states CCD dental hygiene graduates will pursue lifelong learning, self-evaluation, evidence-based decision-making through the application of critical thinking and problem solving. 5.1 and 5.3 were demonstrated through the water fluoridation paper we completed in Community Dental Health, where we used evidence to support our ideas around the benefits of having water fluoridation. 5.2 was demonstrated through comparing the oral hygiene instructions given to a patient about a year apart. Originally, it was most important to encourage the patient to start brushing 2 times a day. And then a year later, it was more important to encourage the patient to use a high fluoride toothpaste due to the hypersensitivity that they are having. 5.4 and 5.5 were demonstrated through going to the RMDC and completing many CE courses throughout our time, which is going to continue after we are done here. 5.6 was my patient case. This patient and I had conflicting priorities. Her priority was to get the cleaning done in as little appointments as possible. My priority was to get the cleaning done thoroughly, and the patient got upset in this process. This is her health history, her treatment plan, and then the conflict was noted here in the patient chart notes. Patient got upset and almost left because of the pain, and they ended up deciding not to continue the treatment here at CCD. There is the hard charting, FMX, and perio charting. Last, we have Competency 6, CCD Dental Hygiene graduates will successfully complete written and clinical board examinations necessary for licensure. 6.1 was demonstrated through passing my NBDHE, which was such an exciting day when I found out I passed. 6.2 was demonstrated through my fall scaling competency, which is one of my greatest accomplishments because I got 100%, which I did not think I was going to. But here is the full rundown. I got 100%, I couldn't believe it. And then this is the patient's medical history, treatment plan, and then here is the hard charting, calc index, FMX, and perio chart. So in conclusion, somehow we made it. I cannot believe it. These last 2 years have flown by, and I cannot believe it's over, and I'm so excited to see what the future holds. And I would do anything to go back and tell myself on the first day of school that things are going to turn out better than I ever dreamed. And here I am on the first day of dental hygiene school, June 2nd, 2023.